Health officials across the state are making an effort to reach out and register more people despite the vaccine still being in short supply. WMER2 News' Mark Roper explains what local health officials are doing to meet the challenges of vaccinating Maryland.
Health officials have a number of problems to solve. How to encourage more people to register for the vaccine, how to get the vaccine to a wider range of people, and how to deal with a limited supply all at the same time. So many questions for county health officials to find answers to. But the one question thousands of Marylanders want an answer to is, when will they get their shot in the arm?
That's a Healthline emergency number. She was very nice, and she told me I should check my email every day. That was the advice she told me. That was it.
Not much.
I check my email 3 times a day, 4 times a day.
It's a frustration shared by many who are waiting for their turn to be vaccinated, as well as for health officials and county executives orchestrating a vaccination effort for their community.
The biggest challenge is, unfortunately, lack of organization, structure, and leadership at the federal level in the early stages. And when you combine that with poor communication and not really helping people understand realistic expectations.
County health officials statewide are working on different ways to connect with people, especially seniors.
Not everyone is on social media. Not everyone watches television. Not everyone belongs to a social organization.
We've asked our volunteers to go through their church directories, go through their Rolodexes, find seniors, and call them and help them register on the site.
County health officers find themselves in the dilemma of trying to register more people while making sure they have enough vaccine on hand to schedule vaccination appointments.
There's about 48,000 county residents 65 and over, according to Medicare. So with 20,000 already pre-registered, we've got a ways to go to pre-register everybody.
We have a team that includes not only health department staff, but also Cecil County Public Library and the Department of Community Services staff who are reaching out to those folks and getting them scheduled.
Health officials are not only trying to reach more people, but all corners of the community.
Cecil County is geographically quite large, and so we want to make sure that people in the western and southern parts of the county have access. And so we have clinics scheduled in this western and southern regions as well.
Maryland Live and the community college, and they've both been fantastic partners. And we'll be setting up a site at the Navy Stadium in a few weeks. And then we're looking at other, not just large vaccination sites, but smaller sites. So it's just easier for people to get to.
Some people can't make it to a vaccination site no matter where it's located.
We actually are going to have a mobile unit that's going around. It's going to start sometime in February. That's going to go to different communities, to smaller sites. And we're working with the Department of Aging to vaccinate homebound seniors as well.
Right now, my nurses are able to vaccinate 80 a day. And right now, with such a shortage and such a crunch, I got to keep my nurses in my clinics vaccinating 80 a day, and I just can't afford to have her go with a cold box and vaccinate 5 or 10 shut-ins a day.
For more information on how to get vaccinated in your area, just look for the Vaccinating Maryland section on our website, WMER2news.com. Reporting for WMER2 News, I'm Mark Roper.